So as a Mohs surgeon, we tend to focus on skin cancer in particular, and skin cancers that can be quite aggressive. As a result, especially here at our practice, we tend to function somewhat like a regional referral center. We see some of the more aggressive skin cancers in the whole, southwestern Idaho, eastern Oregon, northern Nevada region. So that's given us a bit of a expertise on aggressive skin cancers and their different treatment options. And as of late, while Mohs surgery has maintained itself as the most effective skin cancer treatment for things like basal cell carcinoma, squamous cell carcinoma, and also recently a lot of great evidence for melanoma. It has the best clearance rate, as well as can help lower metastases. There have been other modalities of treatment that have been experimented with and brought into the forum for discussion and for use. And it's always worthwhile for us to review these, to consider these, and that's something that we do very often. And I bring these up just because we get lots of questions about what are the other treatments for skin cancer besides Mohs surgery. And so that's the topic of what we're going to talk about today. So Mohs surgery, just as a quick review, is a surgical removal of the skin cancer with a complete histologic margin, meaning we look at the entire margin under the microscope to make sure that it is clear. After that, whatever is left behind, we're able to fix. The way we manage this allows us to remove the least amount of skin. Now, it does require cutting and suturing, which people will, in their minds, understandably think is quite invasive. However, what's done to your skin is actually about as minimally invasive as you could possibly conjure up. So there are other treatment modalities such as radiation therapy, which is definitely a well-proven treatment modality for most of these skin cancers. Radiation therapy does not require cutting and suturing, and recently radiation therapy has been trialed and is continuing to be innovated in ways to be used outside of radiation centers. We consider this a very promising, addition to the lexicon of different treatment options for our patients. However, we have to take into account how effective it is, as well as whether radiation therapy is truly less invasive than something like Mohs surgery. Radiation therapy, as of today, is still not have as good of a cure rate for most skin cancer treatments, or for most skin cancers that we see. It would not have as good of a cure rate as Mohs surgery. And that's simply because you don't check the histologic margins. They just take it, treat it with a certain amount of radiation, which usually is measured in a unit called grays. And the radiation oncologists and their physicists that work with them have gone to great lengths to kind of do studies exactly to see how many of those rays over how much time is most effective. Outpatient radiation therapy is being experimented with, again, a promising thing, but at this point, we still don't know how effective it is compared to Mohs surgery. It doesn't seem to be nearly as effective in most cases. Certainly not something that at our practice we're comfortable with on people's faces, for example, or especially not with high-risk skin cancers. And also, when radiation is done to the skin, it does a significant amount of damage. And we see that. Those of us who cut into the skin and suture it are very often coming across these radiation sites, and they can be a real challenge. So if something area is radiated, it can't be radiated a second time if there's a recurrence or even a new skin cancer that grows nearby, which is a common problem, to get another skin cancer in the same region. When something's been radiated, it becomes a real challenge to remove it. We have to do it surgically, and now there's no skin flexibility, for example. That is not nearly as much of the case, or not the case at all, if it's been surgically removed in the area. Typically, minimal scar tissue is present. We're able to work around that just fine. So that's one example. Topical therapies are also a popular idea, at least. People love the idea of rubbing a cream on there, whether that's some of the topical chemotherapy agents we've been trialing and do use on a frequent basis for precancers. Or lately, there's been a lot of discussion on topical ivermectin. Topical ivermectin, of course, ivermectin's an old antiparasitic drug. It's very safe, generally speaking, so as a result, it gets tried a lot. It gets experimented with. Experiments are generally good ideas. And so there are certainly a lot of things it can treat. Treating an invasive skin cancer from a theoretic standpoint, that is really not a plausibility. That's certainly nothing any good surgeon or good manager of skin cancer who's worth their salt would ever recommend. And I'm not putting it down. It's just while it can treat some things and while it might make your skin cancer look less red, I'm just warning you not to trust that as a treatment option for your skin cancer. Um, so those are the ones that we have to date. There are also other things like electrodessication and curettage that your dermatologist can speak with you about. That is certainly a time-proven treatment for certain types of skin cancers in certain areas. Not as much the face or head and neck, but certainly in some cases, even on those areas, it is a time-proven thing that can be used.